yesterday, and that has gone really well. The process is very smooth and well oiled. People are able to get it in and out in a very timely manner. So we're very proud of the work of the team to do that.
That's terrific. We want to watch that unfold here and ask a couple more questions about that. Now, we're talking first vaccines for this group, right?
That's right. This week, next end of next week, we'll start on second vaccine doses for people that we had vaccinated about 3 weeks ago. So.
Okay. All right. So that's an ongoing process. And of course, people will have their questions. And the question, I think, number one for most people is when is my group? What group am I in is also a big question for folks. So help us understand again, how do you determine what group you're in, and then what should you do with that knowledge?
Sure. At this point, we're vaccinating people who are working in the healthcare fields in a broad sort of sense, including people such as mental health workers who are in the front lines of working with people, along with people in the hospital, nursing students, those that are really trying to help the community to be safe and healthy. And we're also vaccinating people who are over the age of 75, or 75 and over. At this point, we had a list of over 4,000 people who are in that age group, and the list right now is about 2,700 of those people who we still have to vaccinate.
Still working your way down through it.
Working our way through, yes.
But it is going. And that's technically group 1A, correct?
Correct.
All right.
It's a subset of the group of 1A. There are lots of people that are in 1A,
Yeah.
and lots of people who would really like to get vaccinated.
Sure. And so for those people, and even for people in 1B and 1C, whatever category they fall into, what is the recommendation for when they should call and or sign up online, which is the preferred and recommended way to get yourself in line for a vaccination?
Right. People can go ahead and for people that are over the age of 16, particularly those that are over 65, can go ahead and sign up through the website form. That you can get to it from irmc.org/vaccine and sign up there to be able to see what category you fall into and be able to put your information in, and we'll be able to contact you once we have an appointment slot for you to be able to get to.
So get yourself into the system right now, and then when it's your turn, you'll be contacted and
Yes.
the time will be set up for you.
Yes, and we recognize that people are really concerned. If you sign up once, you don't need to sign up again. We just need people to sign up once.
Yeah, all right. And so that should put people at ease and also probably drive up the traffic right now.
That's We have over 12,000 people signed up at this point, so the interest is quite strong.
Yeah, and right now the shots are primarily being given at the KCAC, but of course you could set up other clinics at other places when the time comes.
At this point, we're restricted based on the type of vaccine that we're doing with the Pfizer vaccine that is quite unstable, and we're not able to do it at other centers and other sites other than the hospital and just down the road there at the Kowalczyk Center. So right now we're restricted to those two sites.
Pfizer vaccine, the Moderna vaccine, you've not gotten any of that. The Johnson & Johnson vaccine will get into the pipeline soon as well. And so it will expand across Pennsylvania. It's just it's like Christmas coming, isn't it? Because what you're
very
doing
much so.
You're looking ahead, and the closer you get to it, the further away it seems.
Correct. And the vaccination plan is evolving both at the state and the federal level, and so we're not entirely sure what the plan is going to be, whether the local emergency management system is going to be involved in it. Local pharmacies are getting vaccine, and at a rate that is increasing. So it is a little bit of a confusing system across the state and the country right now.
Tell me about the IRMC team that is working on this. You have to develop a strategy, and so team members come on and squads are formed. You've got people that are at the hospital that are helping to get the vaccine list and the appointments made and everything, those calls made. You've got that team. You've got the team at the KCAC. You've got people transporting. It's quite an endeavor, and it takes quite a bit of coordination, does it not?
It takes an entire team, and the team has been learning and improving as things go. We starts with our pharmacy director, who's responsible for receiving the vaccine by air transport and loading it into our ultra-low temp freezer and monitoring things and making sure that documentation is good. It extends to our our scheduling team and the people who are managing the website and the form and managing the list of people, and it goes straight through to the registration people who are helping to get people registered into the system, and then the people who are doing the vaccinations themselves and are drawing up the vaccine, and then there are people who are working on checking people out, making sure that they get the documentation set up, making sure that they get the second scheduled dose scheduled as an appointment for that. And then I'd also like to call out the people who are working in the lobby. We have some excellent volunteers who are spending, days of their time here, donating that time to go ahead and help people through the process as they arrive at the Kowalczyk Center.
Yeah, one of the things that we talked about last week that we need to reiterate with people is when you go to get your vaccine, be masked up, be prepared to keep your physical distance from the person in front of you and the person behind you. And that safety protocol must remain in effect in order for this to have any sort of effect at all.
Exactly. This is a part of the process to help prevent the disease from happening and affecting more of our community. It's the masking, the social distancing, the hand washing, and also the testing to make sure that we know who needs to be isolated, particularly because this particular disease, people can have it without having any symptoms and transmit it, and so that's a very challenging disease to be able to manage.
One of the other things that occurred to me the other day was that it takes a lot of people in order to do the cleanup and the disinfection of the site as well.
Yes, and the staff of the Kowalczyk Center have been very good making sure that they follow their protocols, and they're doing that really behind the scenes so people don't necessarily see that, but they are, every time we do a vaccination program, they are going through and decontaminating the space, and just on the off chance that someone happened to be there that had the disease that didn't have symptoms, we're asking for people, if they do have symptoms of a cold or an illness, that they go ahead and ask to reschedule their time there. So they're doing an excellent job there at the Kowalczyk Center.
Dr. Richard Neff is with us this morning, Chief Medical Officer at the Indiana Regional Medical Center. As this pandemic has unfolded and as you have been involved in it as well, at the beginning of it there was so much unknown, and every day more and more becomes known about it. It changes the way that you as a physician and your staff have to react to the realities of the day. As the information changes, it requires adjustments on your part, does it not?
It does, and we are modifying things just as we're modifying our processes at the vaccination center, but we are modifying our processes in the hospital and on the floors to be able to adapt, to be able to change. For a long while, we've had restrictions, very significant restrictions on visitors at the hospital. We're hoping to be able to look to change that as we see the vaccination numbers increase and the incidence of the disease and the prevalence of COVID-19 in the community go down. We'll still need to contain, deal with social distancing, having people in very limited numbers, working on hand washing, and having people stay away when they're ill.
I'm a huge fan of baseball, and I watch it in the off season as much as during the season to see what's going on behind the scenes. As a physician, I'm assuming that you're also a fan of what's going on behind the scenes in COVID-19 developments from the CDC, from the national folks, and from the State Department of Health. Are you as fascinated by that as I might be over what Willie Stargell hit in 1966?
Indeed, and it is one of the most interesting things to go ahead and look at, think about, see where things are going. And also there's an awful lot of information that's out there. The thing that is different about medicine and science versus baseball is that baseball, you have numbers, you have very clear, you know what the ERA of someone is, and there's no debate about whether it's higher or lower or what it actually means. In medicine, there's an awful lot of information out there that is put out there that is part of the scientific process of evaluating and working through things that you don't necessarily know all the answers, even though you're having things that are published and talking about things. So often some of the answers become known later. You look back early on, we didn't know whether or not masks were important in the very early stages of this. It became abundantly clear that yes, actually, masks are very important to help to contain and stop the spread of the disease. So it's just one example of things that we learn over time.
And baseball's been the same game for about 150 years. Pandemic, it changes every day.
Indeed,
The
indeed.
rules change, the game changes every single day. All right, Dr. Neff, final thoughts here this morning. What do people need to know about the COVID-19 vaccine and they're protecting themselves from this very dangerous disease?
I think there's a couple of different things. One, for us, we are having to do things as a scheduled appointment just on the vaccine. We have not done any waste of vaccine, and I urge people not to come to the center to go ahead and hope to be able to get the vaccine. We have our own processes to make sure that we call people on the list that are in the priority list to be able to come in if we have extra vaccine on the end of the day, and doing an awful lot to try and make sure that we don't waste any vaccine at all. That's probably one of the most important things. But the bigger thing is that it's only part of the way that we're going to beat this. It's the masking, the social distancing, the washing hands, the isolating if you've been exposed to somebody, and the quarantining if you have the disease to try and help stop the spread.
Terrific. We appreciate your time this morning. I know you're headed over to the KCAC again to check in with those folks, and we appreciate your making the trip, the side trip here to Renda Broadcasting.
Absolutely, and thank you, Mr. Marino.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.